Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
And she talks about how she spent most of her life not putting off anything, enjoying life as it went on. And so how she felt good that she had done that, and so that she has few regrets, and she's been blessed, and talks about how you have to take advantage of things as they come and not put things off till tomorrow, because tomorrow may never come. So it's interesting perspective of a 49-year-old lady who's just been told that she has terminal cancer and she will live at most a couple of months. Of course, one of the things that's true is that doctors are wrong also. So, but anyway, I thought it was an interesting story for somebody to actually write about themselves and to show how they spend most of their lives actually enjoying their days, and how she now has no regrets.
There's a movie written about that, starring Queen Latifah. She found that she had only days to live. Anybody seen that movie?
Yeah.
Betty saw it. Carol saw it. Okay.
I saw it.
A lot of people say, what's the name of it?
Now you're gonna have to ask Daryl.
Yeah.
I can't remember either.
I have to do a Google search.
Well, we all raised our hand. We've seen it. So
Yeah.
what does that mean?
We getting old.
Yeah. They say the commonest complaint that people have after 55 is that they forget things.
Yeah.
So, okay, I guess we can start. We have a large number of articles. So this is kind of a disappointing observation that this lady made, that she asked for a disability ramp and they offered euthanasia. That's pretty tough to get feedback like that when you ask for help. Just because she's in a wheelchair, it doesn't mean. But anyway, it's how insensitive some people can be. Although I'm sure it's written up because it's exceptional, and there's so many people who are wheelchair bound that I'm just surprised that anybody would be that insensitive. What are your thoughts about that?
Wasn't that former President Bush?
Yeah.
That was in there.
Yeah.
Say again?
Former President Bush was the one offered that to her.
No. He they just had his picture, but he wasn't involved in that. That was in Canada.
Yeah.
Kind of sad.
Well, while we're thinking about comments, that Queen Latifah movie was called Last Holiday.
Yeah.
Oh, okay.
Sure was. Don't we in the United States have some kind of law that requires them to have certain things for disabilities?
Yes,
Yeah.
we do. By the way, how often do you think does somebody in the world commit suicide? How often? You think every hour, every minute, or every 2 hours? Or what are your thoughts?
Well, you're hearing about it now. I'd say every hour.
I'd say every minute.
I would say every hour. It's happening a lot now, according to the news.
Yeah.
Yeah.
Well, tragically, it's every 40 seconds.
Oh, my.
Mm,
That's just a little under an hour. Yeah.
mm.
Little, 40 seconds, not 40 minutes.
Oh,
40
40
seconds.
seconds.
Yes.
Yeah. Oh, yeah, that's a lot of,
Mhm.
40 seconds.
yeah.
That's someone in the world is committing suicide every 40 seconds.
Mm.
Can you imagine that? That's horrifying, isn't it? That
Yeah.
we have such little value for our lives that we're killing ourselves, and the life is so bad for us that we are committing suicide. What are your thoughts about that? That's kind of frightening, isn't it?
Mhm.
Very frightening.
Very frightening.
It shows that people don't believe in God as much anymore, and feel that life is vain. And you wonder how it was before we came so occupied with everything else.
Yeah,
And
I'm
then,
reading that the world suicide rate in 2019 was 1.3%, or over one out of every 100 deaths. And the suicide rate was twice as high for men compared to women. And over half the suicides, 58%, were before people reached 50 years old.
yeah,
I was surprised by this. 10,000 people died in Canada in 2021,
yeah,
and that 13,500 in 2022.
Mhm.
Mm.
yeah,
Going up. Mm.
yeah. It's a sad commentary on life that so many people are killing themselves.
Yeah.
I think because they have glorified death, you can die painlessly. Even, executions, they sue if you feel too much pain. Religious organizations, whether they're Christianity or when you die, it's a much better life. And we say that they're in a much better place than if they stay here on earth. We have just made death seem so frivolous and wonderful that we say it to each other, they're in a better place. So consequently, death is no longer feared or cruel. Our fate is, I'd rather be dead than to stay alive, which shouldn't be, because death is a curse. And they don't even want us to mourn. We've talked about that subject before, in churches. Let's celebrate that they died. So why shouldn't people say, well, I have a much better life if I'm dead than if I'm alive? Somehow,
But it's not life. How can you say it's a much better life? You say
but
you may
we
say
say that they're in a much better place. We
oh,
don't even respect life anymore.
Yeah,
well. Any other thoughts?
yeah, but
Yeah.
Carol, they, even when I was a child, when someone died, they would say they were in a much better place, but you didn't have all these suicides going on. So it must be something else other than just that, because I've always heard, I've been in church all my life, and they, whenever someone dies, they always said, well, they had gone to a better place and that God is prepared and blah, blah, blah. But people weren't committing suicide like they're committing suicide now. So it's got to be something else going on.
I think they finally drank the Kool-Aid. They really believe it's a much better place. And we're just lying to them when we say it's a better place. It is not. We want to think that to help ourselves mourn, but death is it's really a curse.
We don't
Then you say, how
look at
do
it
you
like that.
know?
We don't know.
Yeah.
Yeah.
I don't think, excuse me, hi, everybody.
Good
Hi.
morning.
I think that it's because people are meaner to each other now. I find people are so mean and so evil, so unforgiving, relentlessly chastising people and not having any mercy or forgiveness. And I also feel that people see what other people have and they don't feel they have it and they don't feel worthy to be here. And that fuels them not wanting to be here because people post things, people, there are ways to get to you and there are ways that people see what other people have. And there's a lot of envy because people are not valued. That's my take on why people are so um, why they're killing themselves. They don't see the value in their lives as compared to other people.
I vote for Mary Ellen.
Yeah.
The other thing too is that when you have funerals, they start saying, let's have a celebration. They didn't always do that. Now they have a celebration when somebody dies because you're supposed to be happy now that somebody died. So let's celebrate.
But I don't think that's what they're doing. They're celebrating the
The
life
life.
that they've had. And they're trying to uplift the people that are left. Maybe they're not conveying the information, but I don't think I'm celebrating that you died. I'm thinking that I celebrated the life that you have and the life that we had together. And it's trying to comfort the ones that are left behind.
Right.
I agree with Mary Ellen. This hits home for me. My very closest friend, her husband died last night. So I haven't too long gotten back home. He was older, he was 84, and he had been in a hospital and nursing home for the past 98 days. What got him out? His daughter is due to be married Saturday. And he kept saying, I gotta come home. I gotta come home. He came home Monday. What's today? I'm losing days. And they got him fitted for his tux or whatever. I mean, mind you, he can't even walk. I mean, he's in a wheelchair. Very excited. And they said that morning, yesterday morning, he just became very lethargic. He sat down and died. But they said life goes on. They will celebrate based on what they knew he wanted. He wanted that wedding to happen. And he was home for a few days to be a part of the hustle bustle, getting the clothes ready, getting the decorations ready. So you do celebrate that person's life and how they feel that person would want you to move forward. I do believe that death shouldn't be a sad thing. And I do believe life goes on. You just don't hold back. You celebrate.
How many think that it has to do with a lack of faith in God, and as we see less people becoming religious, that this may be one of the reasons that's associated with it?
I think so.
I think so too.
I do too. But, we're all saying this, but if you read the scriptures, even Christ cried when Lazarus died. There's only a couple of times he told his prophets and priests not to mourn when your wife died, because that is a process. And when we talked about it before, the natural process of when anyone dies is to mourn, because there is sadness, but we don't want people to mourn or be sad, which you are really stifling. You're stopping a process of life that you need to go through. and we don't want anyone to cry anymore, which is a process.
But
They said, we've gone through this before. We're being
except it's not true that we don't want anybody to cry, because crying is healthy.
Yeah.
It's
Crying is a
healthy.
healthy process.
But if to have a funeral and not to cry and not to mourn is not a natural human effect.
I agree. But what I'm saying is crying is healthy.
Crying is healthy.
And mourning is healthy.
We're telling people don't cry.
No, who's telling people don't cry?
Churches.
Well, that's a mistake.
Oh,
No.
yeah, it is. I don't know that. I certainly have had sadness. I've lost 2 children, which is really not normal
Right.
in today's society, but I was sad. I cried, but I also knew that they knew the Lord. And so I took comfort in that. And I went on. And I know, to me, I don't think they lived a full life, but they had to have, because the Lord took them home. So that's just the way I feel about it.
I played at a funeral where they wore white. The preacher brought whistles, you know what you do at New Year's, and told everyone to celebrate. Well, I felt sorry for that family that's sitting there and they're mourning their loved one, and they're telling that congregation or that audience at that funeral, we need to celebrate and blow whistles and cheer.
That's extreme. That's extreme.
It was extreme, but it was done in a church during a funeral.
I think we all grieve in our own way. We read books, people tell you the grieving process is A, B, C, D. I don't believe that. I don't believe that. We grieve in our own way. We don't have to cry to be sorry. We don't have to be sad to be sorry. It's an individual feeling that you have. I just hate this thing. You got to do this to grieve. You got to do that to grieve. No, you don't. No, you don't. It's individual.
Over in Jerusalem, they have what is called a wailing wall. And it's a place designed for people who want to come and grieve and get their grief out of the system. Grieve, the sadness out of the system.
As if that's possible.
The purpose of this article, talking about medically assisted dying. We kind of a little bit got off the topic, but when the government comes in and takes a stand on this, I think this brings up a lot of issues. What role does the government have in allowing someone whose life is like we were talking about, life doesn't feel like it's worth living because of so much pain? They're in pain and they choose to end their life. And several countries around the world are considering the same thing, helping someone. I remember the movie Soylent Green, where Edward G. Robinson was on his deathbed, and they gave him LSD so he could trip as he was dying. So there are a lot of people who are considering that, especially the ones who have the chronic pain. And a lot of the people in chronic pain end up, with pain medication that, makes their life very, very, very unmanageable. And even though they may not feel the pain of their ailment, they may not be feeling anything. So something to think about.
Okay, that's go to the next one. We've discussed this appropriately, I think. This is an interesting article because it talks about stop drinking, keep reading, and look after your hearing. And it gives other tips for fighting memory loss and Alzheimer's. Forgetfulness is something that is common after 50 and sometimes before 50. And sometimes it's inconsequential. Sometimes it's not. But what he's saying, though, is that things that contribute to loss of memory are lack of physical exercise, drinking, smoking, and he points out that getting your hearing fixed and wearing a hearing aid and not smoking, drinking, physical exercise, and reading helps the mind. And so these are things that you can do to help yourself rather than just worry about the fact that you can be forgetful. And I guess the question is, who isn't forgetful? But if you think of the positive aspect of it, and as he says, quit alcohol and sleep well and read, these things perhaps will prevent you from having Alzheimer's and dementia and help you keep your memory. I know that we've talked about the mind games that we deal with, the mental exercises that go on with chess and checkers and those kinds of things. And suggesting that reading is something that will keep your mind occupied as well, along with the other things that they mentioned. Any other thoughts about this? Because, you know, one of the things that is true is that there isn't any real effective treatment for Alzheimer's. And so an ounce of prevention may well be worth a pound of cure here as well.
Yeah,
So
further up the article, they were talking about hearing.
yeah.
That if you don't hear, you tend to avoid conversations, or you can't really participate in conversations, and the mental cogs don't turn, and so people get quieter. They tend to shut down, withdraw, and they get more forgetful. And I think that's really important to take care of your hearing.
50% of those people who have hearing problems and don't get hearing aids have Alzheimer's, as you suggested. But those are the things that you can take away from this article, that the positive things that you can do to try to prevent the cognition changes that go along with dementia.
Yeah, people tend to underestimate the hearing loss. Say, well, yeah, I may be a little hard of hearing, but they realize they're a lot hard of hearing. So if anybody tells you you don't hear too well, you need to get some hearing aids, and you're in denial, you probably have over a 50% hearing loss, and you've been a candidate for hearing aids like 10 years ago. So, run as fast as you can and get a good pair of hearing aids.
Good advice. Good advice.
Yeah.
Okay. What's that, John?
Stop talking about me.
Well, then go get you some hearing aids.
I can't run fast though.
Much as a huge car.
I have a question. People with dementia, and you recognize the signs and symptoms. Is it any good of telling them, or if they're working or something like that, and you see the signs, and even though we are amateurs, but you see the signs, what should you do for them, or should you just leave them alone and just let them take life as it is?
You should tell their families so they can support them and keep them from getting in accidents. because I think the family can be helpful to them so that they aren't put in circumstances that uh, so they get lost in those other kinds of things. So if the family is aware of it, they can then make sure that they have the supervision that they need. Maybe they need to stop driving, and some other things. But those are things that you can do since you can't uh, affect the dementia itself. You can protect the families can protect them from hurting themselves, and that's the major take-home message that I would think that you need to have to make sure their family is aware. If they live alone, that's an even greater reason for them to get assistance. But assistance is what happens, and that's one of the reasons why people who have big families have an advantage, whereas a person who lives alone will need to have somebody to take care of them.
Someone with dementia, like if they're president of the United States or a pastor or some high political or prestige, and the family recognize they have dementia, but that person doesn't, should they warn the public, don't vote for them or don't elect them because they have dementia?
No, because I don't, to what extent is the dementia? Is it only to the extent that they forget some things, since most people forget some things anyway? So it depends. If they're capable of functioning, that's one thing. If they're incapable of functioning, that's another. Because they're incapable of functioning, then just like Ronald Reagan, when he became incapable, he had to be supported, and that's why you have vice presidents. But so when they can no longer function, they have to be relieved of their duties.
If you try to if you try to tell them, most of the time they don't believe you anyway.
Right.
They just go on and do what they're going to do. So I agree with Dr. Callender. It's the families that need to be told. I'm thinking about my stepfather, and the only way we kept telling him he didn't need to drive, but he drove until one time he went to church and he couldn't find his way home. And so we all went looking for him, and we eventually found him. But then that's when we called the DMV and told him they need to take his license, because he wouldn't pay attention to us, but he would listen to the law. So they had to send him a letter telling him that he could no longer drive. And he paid attention to that, but he did not pay attention to us when we told him. So you just have to kind of look out for them, but they are going to listen to you if you tell them.
How far away was he from home?
He had gone to a place where he used to live. He had remembered the old neighborhood, because that's what the police said. Why don't you search some of the places he used to live rather than where he was living? And that's where we found his car. And then he had left his car and he had walked down, and he was sitting in front of a Safeway. And they spotted him because, like I said, he was coming home from church. He was a deacon. He had his suit, tie, everything on, and they knew he didn't have any business. A person didn't have any business sitting in front of a store. So that's when they found him. But yeah. So
Interesting story.
yeah.
Okay.
Yeah, did Betty, I don't want to, keep going on this, but did he know he was lost?
I don't think so. I don't really think so. He came on back home, and they brought him home, and he stayed there, but he didn't exhibit like he was afraid or upset or anything like that. I just think he just could not remember. And so he went to what came to his mind, and what came to his mind was a place he used to live. And that's where he went and parked the car, but then maybe he couldn't find the house or something, I don't know.
Mhm.
But he ended up sitting in front of the store, and that's how they found him.
I had a similar situation with my mom. She had gone uptown to pick up one of her girlfriends to bring her to Spingarn for a computer class and got lost.
Mm.
The police escorted her back to all the way across town from up by Coolidge over to Spingarn. She never did pick up the person she went to because she got lost, and we had to take her keys as
Yeah.
well. That's a very upsetting time of life, to lose that freedom.
Yeah, yeah. But
Mm.
did she ask for the police to help her?
Yes.
Oh, yeah. Well, she wasn't as far gone, I guess, as my stepfather.
Mhm.
I don't think he really.
Well, actually, the police stopped her,
Oh,
and she was crying, and the police said, "What's wrong?" I said, "I can't find my way." So they they drove her back over to where she knew where she was.
How did they know where she lived?
Well, she knew where she was supposed to be going, but when she went to pick up her friend, that's when she got lost. That was kind of an unfamiliar area. She hadn't been there in a while, I think.
mm.
Okay. Well, this is a interesting, well, not so interesting story as it's something that you like not to happen. Here's somebody, they did a C-section and left a medical device in the person, and the wound retractor was causing pain. And so when they uh, took an X-ray to find out why she's having so much pain,
Mm.
we found out that they had left a medical device inside of her. And this is, of course, one of those so-called never events that we're having too many episodes of. And
Well,
this is
Doc,
just
I'm sorry, Doc. The X-ray didn't pick it up. They had to do a C scan,
right. That's right.
a CT scan.
Yeah, CT scan because um, uh, and we just had a recent case with similar involvement. The regular X-ray missed it, but the CT scan picked it up.
Mm.
So, but of course, when you have after in every surgery, you have a count, a sponge count, and a count to make sure that everything that you put in is retrieved. And sometimes, in spite of a correct count, you have episodes like this happening.
And that happened to my sister-in-law. You said sponge count. They
Yeah.
couldn't count. They left sponge in there. But it went on for months. Extreme pain, extreme pain. It was several months, 2, 3 months before they realized there was a sponge left inside. She had a cesarean, and apparently somebody missed something. Yeah, so it happened. Mhm.
After the surgery, she had no more pain.
She had no more pain. She did well. Mhm. And they told her the pain came from giving birth. You had cesarean, and it was months, quite a few months. Mhm.
Wow.
But she's fine.
Mm.
Mm.
Wow. Okay. All right, next one, please. This is an interesting article by Tony Fauci, and it talks about all of the incredible ways in which COVID-19 has impacted us. Of course, number one, you have 1 million lives lost in the United States and 7 million lives throughout the globe. Plus, you have so many medical health fatalities from people who are taking care of patients who had the virus and weren't adequately protected. And it's also a fact that, in spite of that, many people elected not to be vaccinated. So the profound nature of the way in which it affected so many people, not to speak of the unspoken healthcare providers that actually left the workforce because they think medicine is a dangerous place to work. Telemedicine now is common. And then look at that, $32 billion invested in RNA vaccines. But of course, that means they went to the pharmaceutical industry. And then, of course, you can scroll down to see some of the other impacts. Of course, they don't mention the increased rates of anxiety, depression, and substance use disorder, as well as suicides and other self-harming behaviors. And then there's long COVID. And then there are other systemic inflammatory findings that go on and on. And so we don't even know all of the long-term impacts of COVID. We know some of them, but some of them we're going to learn as more and more people demonstrate the effects of COVID that we aren't even aware of. I guess one of the biggest effects is the burnout in medicine and the healthcare people who have actually left medicine and actually committed suicide and other things. So, and so we don't really know the total long-term effect of the pandemic, but what we know now is enough to appreciate that it had a huge impact upon the way we live, and life will never be the same for most people. Of course, one of the things that they don't talk about is there still are people who have diseases that they think are related to the vaccines. And you still have people who believe that not wearing a mask and not getting a vaccine is the right thing to do. So,
Yeah, Doc, to me, that's one of the worst results of the pandemic, and the politicalization of medicine, people saying not to trust a doctor. I mean, come on. You go to a doctor to help save your life. Now, don't listen to your doctors. Don't listen to the scientists because, they don't agree with us. What's going on? That's terrible.
yeah, that's one of the incredible side effects of that, as you mentioned.
I kind of had a surprise the other day. My doctor's office called me for my yearly physical, and they said it would be a telecall rather than going to see the doctor.
Really?
Yeah,
Or physical.
that's why I said I had a shock.
What about the lab tests and stuff?
That's what I'm saying. I don't know. I'm going to wait and see what happens on this call.
Oh, I see.
I haven't had it, but they
Yeah, I
called
see.
said
Yeah, that's another. That's a side effect of the.
definitely.
Yeah. Yes.
Yeah. So I'll report what happens.
Yeah, it'll be interesting to hear, based upon some of the articles we've talked about. That even when you go to to the doctor, sometimes they don't do
Yeah.
some of the tests that we want them to do.
Mhm.
And
So if
that,
we don't
that
go
is
at all, so if you don't go at all, I wonder what's going to happen. Well, we'll see, huh?
yeah.
Janice, you were going to make a comment?
No.
Oh, okay. You know, the pluses of telemedicine for people who live in rural areas, but for urban populations, it's not as necessary. The one thing that the pandemic did do, as they talked about that, was to reveal the inequities caused by racism. This is this is why the African Americans and Native Americans were so hurt by it. Latin Americans and African Americans, you know.
Yeah.
Well, as we go on, we we can appreciate that people are more sensitive to the inequities that exist in healthcare because of what was manifest by the COVID mortality and morbidity rates. I attended a session just yesterday that talked about how things are actually changing, so that people are recognizing that thinking that white people are the healthiest people in the
Hmm.
country is not true any longer. And as this nation changes, as a majority minority population change, so does the health of people in the country. Seems like the Asian Pacific Islanders are the longest living, and Native Americans and African Americans are the shortest living. This is something we talked about a little bit about last week, but it's getting worse. And it's expected that this will go up and down until November, when it will really rise. We also have the expectation that the new booster will be available by the end of this month.
Dr. Callender, I'm thinking that the increase in COVID cases, hospitalizations, is directly related to the lack of vaccinations. South Dakota, I think, has one of the lowest percentages of the population being vaccinated fully, you know.
Well, it's interesting to see that if that remains to be the case. Still have such a significant number of people who are not vaccinated.
Maybe Daryl can look that up. The percentages of the state populations that are vaccinated. I'm willing to bet that the increase is going to be higher in all those states with the low vaccination rates.
Well, without looking it up, I remember seeing an article this week that said that vaccination rates in red states were were significantly lower than in blue states. So, we were talking earlier about political influence or the politicization of medicine, and it's the rates of COVID infection, of course, are higher in red states because the vaccination rates are lower.
A lot of people are frightened because they're worrying about isolation and bringing back the masks, which seems to be inevitable, but this is what a lot of people fear. And of course, the other thing with the mask is the closing of stores and restaurants and those kind of things. So as long as the hospitalization rates remain low, then the mask wearing will continue, but testing, but it may not impact things like it did in the previous years, especially if everybody gets vaccinated. But you never know. It's hard to imagine since the last booster, only 17% of Americans participated in the booster, the last booster.
Mm.
So it's going to be interesting to see how many people actually get vaccinated.
Yeah, I just heard some schools in the area were sending kids home because of outbreaks of COVID and flu and RSV. And I think last week they had something in Kentucky.
Yeah.
It sent everybody home because of the breakouts. But you know, I don't know. That's a very individual thing. But you know, when I go into a room now, I'm wearing my mask.
Good advice.
People are there. I'm wearing my mask. I can't afford to have the insanity of getting somebody else sick. That's not good.
The National Convention, National Baptist Convention is being held, and they made an announcement. I think my husband said they made an announcement. They wanted everybody to put their mask on.
Thank you.
Good advice. Good advice. Glad to hear that.
Conventions in general, people should wear the mask. Airports, you know, in conventions and in airports, you have people coming from all different places. And so they bring in those viruses from the places that they have been. And that's why they ask you on all these applications, have you been around somebody that's from out of the country? Or have you been out of the country? You know, those kind of questions, because that's how viruses, one way the virus is spread by people who haven't been around each other. And I think we learned on the group session that, you know, you don't fear as much as the people that you're around a lot.
Okay, well, I think those bulleted points are very valid. If you're positive, stay home. This is a surprise article that talks about deadly flesh-eating bacteria that found in the water, and suggesting that even the ocean may not be safe if you have a sore or open wound. It's risky going into the water because you can get these so-called necrotizing fasciitis, in which you can lose your limbs or your life. It's still rare, but these are the locations. You see New York, Connecticut, North Carolina, and Florida, with Florida being the most prolific one. So,
Dr. Callender, we first heard about this a couple months ago, I think, with the sargassum, because that's where they found the Vibrio, at first in the mixed in with the seaweed that was coming into the beaches, and people were getting sick that way.
Yeah. It's interesting. Those who eat raw, undercooked shellfish get it as well. Interesting, waterproof bandages. It's probably wisest if you have a sore to stay out of the water. This article kind of speaks to the 5 modifiable risk factors for cardiovascular disease, hypertension, obesity, smoking, and diabetes. So control of all of those things becomes critical. Since heart disease and cardiovascular disease is still the #1 cause of death in the United States and the world.
Doc, what's the definition of cardiovascular, and how is that different from heart disease?
Okay, cardiovascular disease may include stroke, heart attack, and kidney disease, actually. Whereas heart disease is just only cardiac, whereas cardiovascular disease, anywhere the circulation will carry, so that stroke is part of heart disease. It's part of cardiovascular disease.
Dr. Callender, how does COPD turn into emphysema? How does that happen?
Well, COPD leads to emphysema because you have fibrosis in the lungs, and the fibrosis destroys the lung tissue, and as a consequence, as it destroys the lung tissue, you're not able to breathe any longer. And so this then results in emphysema, in which you have a larger lung but fewer functioning alveoli or lung spaces that are capable of receiving blood supply. And so that's the process by which COPD, which actually is kind of is the end result, emphysema is the end result of COPD, but it occurs because you get fibrosis of the functional lung tissue, and the end result is that you have a lot of lung tissue that isn't functioning. And as a consequence, as you breathe, you're unable to get the blood, the blood circulation that brings in the oxygen is incapable of getting it into the lungs, functional lung. This then results in emphysema, in which you're going to have oxygen in order for the lung tissue that remains to pick up the oxygen that's there. So the fibrosis that is associated with chronic lung disease, I call it COPD. And this can be caused by smoking. It can be caused by chronic lung infection. But the end result is that you're unable to oxygenate the lung, and the lung is where the oxygen exchanges occurs. And without that, you can't live. So when when chronic lung disease gets to the point where you no longer can transfer oxygen in the lung, then that is part of what results in emphysema, which is just a form of COPD, in which the transfer of oxygen no longer occurs normally, and therefore you need nasal oxygen to help you keep your PO2 at least in the 90s. And as one of the other things that happens is that not only can you not get the oxygen in, you can't get the CO2 out. And so you get acidosis, and that the combination of the CO2 retention and the decrease in the oxygen level result in diminishing lung function and eventually the demise of the patient.
Thank you for that answer.
Smoking is thought to be the leading damaging agent, along with any kind of chronic lung infection like TB or other diseases like that. And then, of course, interstitial pneumonia is another cause of that, which is actually a genetic disease as well. Now, this is an interesting article. Any other comments or questions about
Dr.
that?
Kelly, when I was a little girl, I had a friend that was born with cystic fibrosis,
Yes.
and her mother used to have to bang on her back a couple of times a day to loosen up the phlegm and stuff like that. And eventually she died very young. What do they have a better time now with
They
that
have lung
disease?
transplants.
Oh, okay,
They have
good.
lung transplants for them.
She
Cystic
died very
fibrosis. Cystic fibrosis is one of the leading causes of the need for lung transplants.
young. Thank you.
Yeah. Anyway, this is something that our genetic ancestry is linked to aggressive breast cancer. It's thought to be one of the reasons why African Americans have more breast cancer than other groups. And they talk about the estrogen receptor negative and estrogen receptor positive. If you're estrogen receptor positive, you have more medication that are effective. If you're negative, then it's different because they're harder to treat. And some of this is thought to be related to the association of African American ancestry. And this is something that, of course, that we're afflicted with higher mortality rates than other ethnic groups. What can we do about it? I guess one thing is get your mammograms, and also if you have these genetic susceptibilities and you have any suspicious lesions, then you might even want to get prophylactic mastectomies. But anyway, this is something that we've thought about for a long time, but now we have genetic evidence that it's more aggressive in African Americans. Hence the need for screening, early screening, and also if you have somebody who has breast cancer, you want them to get genetic testing to see if it's a familial trait or not.
Dr. Callender, is this transferable to other types of cancer, or is it just breast cancer?
This is all we know so far, right? So far, this is only information we have that's related to African American ancestry. So whether it applies to others, we don't know that yet.
Dr. Callender, genetic testing for breast cancer. If you do a program called ancestry.com and you go backwards to your ancestry, is that a way that you can find out if you're predisposed for breast cancer if you find it in your ancestry?
Well, you said, see, there are two different things. One is the ancestry, which just goes to finding out where you came from, whereas you're talking about having breast cancer in your ancestors. So if your ancestors have breast cancer, it behooves you to get genetic testing to find out if you do have that susceptibility or predisposition. But that generally, the ancestry tests do not go into that detail. You need to have specific genetic testing for these specific genes. Did that answer your question?
Yes, it did. Thanks.
This is an article that talks about the fact that after you have a stroke, can taking statins lower the risk of another stroke. And the evidence is, based on this article, that it does lower the risk of another ischemic stroke, but doesn't seem to impact the bleeding stroke. Now, remember, there are two types of strokes. There's a stroke which is associated with no circulation in the brain. We call that ischemic stroke. And we have a stroke in which you have bleeding. The ischemic stroke is thought to be caused by blood clots. Okay. The hemorrhagic stroke is thought to be caused by bleeding. And so the bleeding, the ischemic stroke, if you make the diagnosis in time, can be treated and the clot can be removed. Whereas the hemorrhagic stroke has a much is more associated with mortality and inability to treat. Because we can do something about the ischemic stroke, but we don't have, and very often the hemorrhagic stroke is related to hypertension. And so one of the things you can do with the bleeding stroke is to keep your blood pressure under control. But statins will decrease the likelihood of an ischemic stroke. And that's one of the reasons why when you have a sign of a stroke that you need to go to the hospital immediately, because for every minute that you lose close to 1 million brain cells. So, but if you go to the hospital, they have medications now that can dissolve the clot or remove the clot if it's a ischemic stroke. Any questions about that article or comments about stroke?
Yes, Dr. Callender, what are the signs that you have in a stroke? The two different kinds of stroke.
Well, stroke, whether it's bleeding or ischemic stroke, they show the same signs. It can be a headache. You can have go blind in one eye or both eyes. You can have facial changing, paralysis of the face, the lip, or inability to speak, inability to move, partial paralysis. So those are some of the ways in which, so if you have any of those things, you need to go to the hospital immediately. If you have inability to speak, inability to move your lip, go blind in one eye or another, inability to move your arm or leg, or any of those, mean you need to go to the hospital right away to get treatment. They can then do a CAT scan and find out whether you have a clot or ischemic stroke or a hemorrhagic stroke.
Right. I had a instance where I woke up and my face was crooked and I could do everything else. Nothing else was wrong with my face, but I went to the hospital anyway. I thought I was having Bell's palsy and that's what I had. But even though I thought I knew what I had, I wasn't crazy enough to diagnose something as serious as that. But that's
Good.
what I had, was the Bell's palsy.
Good, yeah, because that's another cause of the face twisting, which is different, and that goes away. That spontaneously resolves itself. But you're right. You use good judgment.
Dr. Callender, what's your opinion on Congressman McConnell when he froze at a press conference?
I think we have an article on that, so we're going to talk about that as well. We'll do that because isn't that one of our articles, John? Yeah. So we'll do that at that point. Okay, let's go to the next one. This is a new finding that low-dose colchicine may be better than aspirin for cardiovascular disease because it decreases the inflammation without affecting the bleeding. Aspirin reduces inflammation, but it also is associated with increased bleeding. And that's the reason why if you don't have cardiovascular disease, aspirin is not recommended. But colchicine is a medication that does not have that side effect of bleeding. And as such, it may be a better replacement for arteriosclerotic cardiovascular disease because it will treat the inflammation that's associated with the arteriosclerosis as well as not give you the increased risk of bleeding. So this is a new finding that is suggestive that this may replace eventually aspirin in the treatment and the prevention of cardiovascular disease, because arteriosclerosis is the big problem that is associated with inflammation, and low-dose colchicine may well be the drug of the future for arteriosclerotic cardiovascular disease. Now this is the recommendation, but it has not been actually been proven enough to make this replace aspirin yet. But down the road, it's likely that it will. Colchicine has long been used for the treatment of gout, but it's used at much higher doses. Any comments or questions about it? I know it's new, but I thought it'd be good for you to know about it. Because down the road, particularly with people who don't have cardiovascular disease already. And even with those who do, it might be a good replacement for aspirin because the bleeding complications of aspirin are still evident. One of the things that this article also talks about is that colchicine is not that great for the kidneys or the liver. So people who have chronic kidney disease or liver disease, they don't fit into this category. Now, the role of LDL, or low density lipoprotein cholesterol, is thought to be high in those people who have cardiovascular disease. And HDL is supposed to be protective. So if you have high LDL, that suggests that you need to be on a medication that lowers the cholesterol as well. That's what the statins do. Any other comments or questions about this? This is a futuristic article, but I just wanted to let you know about it. So down the road, your doctor may talk to you about it. And this points out that aspirin has antiplatelet effects, which is why it causes bleeding and why colchicine may be a better drug. And this demonstrates that when you replace colchicine with aspirin, that you mitigate the increase.
Dr. Callender, this is all preventative medicine here, isn't it?
Oh, well, if you have heart trouble, then it's if you have heart trouble and you have acute coronary syndrome, then then it matters. But if you don't have that, then it doesn't. But other than that, if you have a stent and you have thrombosis, you need to have something to keep the stent open. And aspirin doesn't, but it also causes bleeding, whereas the colchicine does not cause bleeding. So in that vein, that's how it becomes.
Colchicine on the market now?
Yeah, it's been on the market.
Oh, okay.
It's been, we just use it mostly for gout and some other things, but it's been on the market for ages. It's an old drug, but it's a new use of an old drug.
Oh, okay. Okay.
This is an article that suggests that low dose aspirin, although it has its problems, decreases the incidence of type 2 diabetes for people over 65 years of age, at least in Australia it did anyway. So,
Didn't do.
Were you making a comment?
Yes, sir. I have I take the low dose aspirin. I have type 2 diabetes also. But I noticed that my A1C is going down since I stopped drinking artificial sweeteners and drink mainly just water, occasionally coffee. But I take the low dose aspirin. I was mulling whether or not that's something I should think of because I don't have any cardiovascular disease at this point. But then I don't want to have the kidney or liver problem either. So I was just mumbling that over in my head.
Well, aspirin doesn't cause kidney or liver problems.
Right.
But it does cause a bleeding, though. Yeah. But it's interesting that in this group, that over 65, they did show that there was an advantage of taking aspirin. Now, this is something that a lot of people are interested in. It's amazing how much pharmaceuticals make. And in this article, they show that Eliquis, the government pays up to $16 billion for Eliquis. And because there's so much money, the government is going to try to negotiate with the 10 drugs that are on this list and try to see if they can decrease the amount of money they spend. And they try to say $25 billion per year. That's the goal. Whether they'll be able to do that is a good question. But one of the things they can do, they can negotiate to decrease the price for those people who are on Medicare. And this is something that seems to be desirable. Now, the pharmaceutical companies won't like it, but I think that it's our money, it's the people's money, so it makes sense for them to. Then you look at all of the money made out of COVID. I mean, my goodness. J&J made $57 billion, my gracious. How about that? Well,
On that list, I saw Jardiance as one of the drugs for diabetes.
yes, that's right.
One of the newer drugs, and
yes,
that's one of the drugs that Medicare does not pay for. My husband has type 2 diabetes, and his regular medicines are like $2, $4, but Jardiance is like $10, $12, $15 a pill. So it's a big difference.
Wow.
They need to negotiate.
yeah.
Because when he gets a bottle of Jardiance, I think it's like $80,
Oh.
$90, where his other pills are $10, maybe 12.
Wow.
It's a big difference.
Well, it's going to be interesting to see how that works out because it has potential of great benefits for patients. This is meningococcal disease outbreak, which is a very lethal disease. And they actually have a vaccine for that as well, but it's not very common. And it is interesting that most of the cases are Black or African American, between 30 and 60 years of age.
Mm.
And virtually only one patient was vaccinated. And it's a well-known disease, but it's very uncommon. Outbreaks have been associated with high mortality rates. So they share the measures to prevent, and you can see right here. Good hygiene is always part of it. Not sharing personal items, avoiding contact with sick people, and then of course the vaccine. Meningitis is an uncommon disease, but it's a disease in which headache is one of the early signs of this disease. And if you have a bad headache that doesn't go away, there are many things that you can think of, but meningitis is also one of them. Probably very few people in this room have had a meningitis vaccine.
I had one years ago when I was getting ready to go to boarding school.
Oh, okay. Yeah. Now this is an article that points out that how drugs, fake pills, people who think they're on oxycodone or Xanax, they have some counterfeit pills on the street that have fentanyl in them. And as a consequence, they OD and die from it. And this is what happens. So sometimes you try to get cheap medications, and you get the medications and they kill you. So it's sad but it's a fact. And so because it's killing young people so often, so you have to kind of stick with the medications you get from the pharmacists and not go on the street and get cheaper medications, which could be laced with fentanyl, which is lethal. 107,000 people died 2021, and it's the young people who are dying that's horrifying. Well, I guess you can tell your children and grandchildren not to take the medications on the street because you never know what's in them. Preventing high cholesterol is important. Of course, you have congenital causes of high cholesterol, but those people who don't have congenital but do have high cholesterol, I think it's important to, as he talks about making healthy food choices and having a diet high in fiber and unsaturated fat, vegetables, seafood, physical activity, as we talked about ad nauseum, exercise. And then when all else fails, you have to take medications. Because some people, in spite of doing all of those things, they still have high cholesterol. Quitting smoking, of course, is important to do, as well as avoiding alcohol. It's interesting that alcohol and smoking are both things that we promote. Any other comments about the cholesterol? Okay, if not, we'll go on to the next one. Do you all know what your cholesterol levels are? Because you should know what your hemoglobin A1C is, your blood sugar is, and your cholesterol level is.
I know what mine is.
Okay, and everyone should know what their cholesterol levels are. So
I have high HDL and
high HDL is protective. High LDL is not.
is the I mean I have low HDL because HDL is the healthy and the LDL is the bad, right?
That's correct. That's correct.
Okay. One doctor told me I had the cholesterol of an Eskimo.
Oh, is that right? I don't know. What does that mean?
He meant that I had he had to do my test twice because he didn't think it was as good as it was.
Oh, okay.
Eskimos eat lots of fish and cod liver oil and that kind of stuff, and they usually don't have a problem with cholesterol. That's why he said that.
I see. Okay. So that's good. Okay. Now, this is an article on osteoporosis and reducing hip fractures. We know that women are more likely to have osteoporosis than men, and as they age, and this predisposes to bone loss, and this predisposes to hip fractures. And they talk about what you can do. They talk about stopping smoking, physical activity, calcium intake, and all of those will help reduce bone loss. And one of the biggest things is keeping active. The more active you are, the better off you are. And then a rise in bone density also It's helpful. And so getting bone density tests when you're over 65 is a good idea to see if you're likely to have osteoporosis, and if so, treatment for it becomes important because you don't hip fractures require surgical intervention and are associated with increased incidence of pneumonia and mortality.
I've had 2 hip replacements, but they weren't fractures. So what causes that?
Well, aseptic necrosis is the commonest cause of requiring
Hip
uh,
replacement.
hip replacements, where your circulation into the hip is not good and it causes pain. Do we have a lot of pain?
Yeah, both times a lot of pain.
Yeah, yeah.
I thought
And
it
so
was
the-
I thought it was when I used to slide in home plate when I was playing ball.
yeah,
Guess
but,
that wasn't it.
but we don't really know what causes aseptic necrosis often, but we do know that it is associated with the pain that requires hip replacements.
But I do know that ever since I went through menopause, I've had problems with the nerves in my legs. So maybe that might have had something to do with, you said it was.
Did they look at your back? Look at your spine?
No, I've also had back surgery, but that was sciatic.
Yeah, okay, well, that's more commonly a
Yeah,
cause of nerve problem. And
yeah.
do you have any other contributing factors like diabetes or anything?
No, I don't have diabetes.
Good, okay, so
Uh-huh.
that's good.
Yeah.
Good.
Once the hips were fixed, I'm doing okay.
Wonderful. Good.
Like I said, that one, my left hip, some of the nerves were damaged and I end up with drop foot, but
Oh,
I'm beginning to feel a little, little sensation in my foot a little bit now, but that's why I'm wearing the brace for the time being.
mm,
Mhm.
okay,
But the pain is gone.
wonderful.
Yeah.
Wonderful. Now, this is an interesting article because online pharmacy programs can save patients millions in drug costs. Mark Cuban has a drug company, Amazon also, and Good Good RX also has programs, and these uh, are much cheaper. And they say that potential savings are about almost $2 billion. So those of you who have the opportunity to use these pharmaceuticals can actually save a lot of money. We've seen some commercials, and the commercials do not exaggerate in this situation. So that's something to keep in mind that it is worthwhile getting involved in these programs because it will save you money.
Dr. Callender, I've always been suspicious of those ads on the TV, Good RX and all that. How can they save you money as compared to buying it directly from one of those companies?
It's not, I can't tell you how. I can tell you that they do, and so I think you might try because they actually do save money. How they do it, I'm not sure, but some of it is thought to be related to some kind of negotiations that they make with pharmaceuticals, but I don't know exactly how. But there is it is true that people who use those actually do save money. Many of the insurances will pay up to 80% of the cost, leaving 20% for you to pay. And it may well be that that is where the negotiations are involved. But it is clear that they do make a difference. And, I was suspicious about them as well. But they do make a difference. Any of you use them? Any of you on this call use them?
No, I just yesterday or day before now purchased just regular medicines, Tylenol and Motrin and stuff like that from Amazon, and their prices were cheaper than say CVS or any of the other stores. And I think it's just because they have such a enormous amount of people that use their service and subscribe to the Amazon Prime and all of that. So it definitely was cheaper than going to CVS.
Okay. All right. Any other comments or questions about that? Because I think it's something worthwhile considering. Now, this is a article that suggests that some of these apps share your private data with other places, and it is cautioning you to be wary of some of these apps and asking you to check out some of your apps to be sure that they don't share your telephone numbers and other things, other data. I have no experience with. I'm not aware of it, and it could be happening without you being aware, because you may get calls that you're not expecting, and they may be because some apps that you have they give out your telephone number. This is what they're suggesting you do. I have an Android, so let me try to do this. Any of you have any suspicions that you're getting unnecessary, unwanted calls that may be a consequence of your apps?
I don't use the apps on my phone.
I had an experience where I went to 3 different states in a matter of 4 days, and I was using the GPS, and it was tracking my every step. I looked back, my nephew looked back on my phone, and it showed when I went to the groceries, when I went to every that I went, that GPS tracked everything I did, whether I put it in there or not. And it had a whole record of what I had done in those 4 days. And then I have an app for my sleep apnea machine that lets the doctor know whether or not I'm using the machine, and lets the insurance company know if I'm using the machine. And so, yeah, I know exactly what you're talking about. I'm being tracked.
Yeah,
Amazing.
I've got an iPhone and an Apple Watch, and there's a couple of apps I use all the time for running and heart rate, things like that. But there are settings that says ask app not to track, and I always turn that off so there's no tracking for my apps.
Yeah, yeah. I don't hardly use mine, but I have that Apple too. But I don't really use them, but I always say don't allow when they ask. And that's for anything I have on my phone. Everything is don't allow.
Okay, let's go to the next one because it's 10:30 already. I didn't realize. And this is the article that John had asked about.
Oh, yeah.
Second frees up about McConnell. And there are a number of conditions that actually produce this. Epilepsy is one. Petit mal is a good example of that. Parkinson is another. Stroke, of course, without question, because you have petit mal seizures. You also have transient ischemic attacks, which can present in the same fashion. So that he needs to be evaluated again to see whether he's got any of these conditions, including whether or not he has any Parkinson's disease as well. So, and I think after he has a full neurological evaluation, but TIA is the most likely cause, and second cause, transient ischemic attack, which is a minor stroke, and petit mal epilepsy is another. Petit mal is a epileptic seizure that only thing happens is you stop speaking, and after it passes, you retain your speech. So, but there are ways of doing an electroencephalogram and do a complete neurological examination evaluations and identify the cause. Is it concerning? Yes. And so he should have a complete neurological evaluation before he continues doing what he's doing.
He needs to go somewhere and retire.
Well, I don't think he should retire. I think he should have a full neurological examination.
Well, that too.